My name is Brittany Kiger, and I am a student with Averett University in the RN to BSN program. Hand hygiene, strategy for prevention and health promotion. So what is the importance of proper hand hygiene? It reduces the spread of infectious diseases. As the Center for Disease Prevention, or CDC, states, hand washing is like a do-it-yourself vaccine. It removes germs from your hands to help us avoid getting sick. Hand washing involves 5 simple and effective steps. Wet your hands, lather with soap, scrub for at least 20 seconds, the recommended amount of time by the CDC, rinse with water for 10 seconds, and dry your hands. It's important to remember to wash between your fingers, under your nails, and on the tops of your hands. So what is our main issue and problem? Well, that would be the lack of proper hand washing or hand washing at all. What are the risks associated with this problem of improper hand washing? The spread of germs, such as Salmonella, E. coli, and norovirus through fecal matter, and adenovirus and hand-foot-mouth disease through respiratory droplets. The spread of germs leads to increased incidences of disease and conditions. Therefore, more individuals are getting sick. So what do some of the statistics tell us? According to the CDC, about 1.8 million children under the age of 5 die each year from diarrheal disease and pneumonia. Hand washing with soap could protect 1 out of every 3 children who get sick with diarrhea and almost 1 out of every 5 children with respiratory infections. The CDC also states that a single gram of human feces, which is about the weight of a paperclip, can contain 1 trillion germs. If one does not wash their hands properly, these germs can get onto hands and be passed from person to person, which then can make people sick. Hand washing education is important within the community and helps communities stay healthy. It can reduce the number of people who get sick with diarrhea by 31%, reduce diarrheal illness in people with weakened immune systems by 58%, and reduce respiratory illnesses like colds in the general population by 16 to 21%, according to the CDC. So when should you wash your hands? According to the CDC, you should wash your hands before, during, and after preparing food, before eating food, before and after caring for someone who is sick, before and after treating a cut or wound, after using the restroom, after changing diapers or cleaning up after a child who has used the restroom, after blowing your nose, coughing, or sneezing, after touching an animal, animal feed, or animal waste, after handling pet food or pet treats, and after touching garbage. What will my plan be to meet the needs of the community? To meet the needs of the community, there needs to be an increase of education surrounding good hand hygiene. This will include, but is not limited to, why good hand hygiene is important, the consequences of not practicing good hand washing, and how to properly wash your hands. The education needs to be provided to each specific age group in an appropriate and suitable manner in order to ignite interest and generate long-lasting effects. Although all age groups will be included within the plan for education, adults are the main stakeholders as they are able to not only learn the material, but they are also able to teach others and set good examples for those who may not understand the material themselves. What interventions will be used to educate the community about hand washing? For children, posters will be prepared with large visual props in order to catch their attention. Also, teaching them to sing Happy Birthday twice while washing their hands can make the learning experience fun and entertaining for this age group. This will be implemented at schools, either in individual classes or as an assembly. Adolescents can be a bit harder to catch the attention of. Demonstrating hand washing and allowing them to interact with an experiment using glow germ gel and a black light will visually show them how well, or not so well, they are doing at washing their hands. This is a fun and interactive way to teach adolescents about hand washing and can be implemented into their science class as a presentation. For adults, a pamphlet will be created that includes statistics and how important hand washing is in preventing the spread of disease. As well, a reminder of the proper way to wash your hands will be included. These can be handed out at doctor's offices, urgent care facilities, and hospitals. So how will my plan and interventions be influenced by nursing? My plan and interventions will be implemented and carried out by myself and fellow nurses within the community. Not only do nurses understand the importance of hand washing, but they are viewed as reliable individuals within the community and are trusted to educate others. Staff hand hygiene is always important, but providing access and education to patients in the community is equally important. School nurses in particular will be great resources for children and adolescents, both to deliver the education and to provide a constant reminder to the students about good hand hygiene. In order to assist in this plan, funding and support will be sought out by both the school board and the local health department. As well, the CDC offers many resources and handouts regarding hand washing. In conclusion, we cannot forget that hand hygiene is the single best method to prevent the spread of infection. However, at this time, there is no standard method for measuring compliance of hand washing. Thus, permanent monitoring of hand washing to reduce the transmission of infections is crucial. Education and teaching the community of the importance of hand washing, the risks associated with not washing hands, and proper hand washing techniques is essential in order to see a difference.